Hello.
Hi, how are you?
Good. I'm Dave Visso. I'm here for a consult with Dr. Soffen.
Oh, okay. Hi, I'm Stephanie. It's nice to meet you.
Hi, pleased to meet you too.
If you'd like to have a seat, I'll give Dr. Soffen a call and let him know you're here.
Thanks so much.
Hello, are you David?
I am.
Hi, I'm
David.
Chris. Welcome
Hi,
to Procure.
pleased to meet you. Thank you.
Come on back.
All right.
Hi, Mr. Visso?
Hi, Dr. Soffen. Yeah.
Call me Ed. Hi.
Okay, hi Ed.
Nice to meet you.
Same here.
Have a
Same
seat.
here.
So I can imagine that the past several weeks and even months have been quite a journey for you, maybe even difficult. I'm curious if you could cue me in on where it started and how you got to me.
Well, it started at an office visit with my urologist, and it was not looking at my prostate, it was really something else. And he said, while you're here, let's do a prostate exam. He said, there's something going on down there, and he wanted me to do a biopsy. So got the biopsy, came back, the results were a Gleason 7.
Mm-hmm.
He said, you really have to do something about it. He sent me to have a CAT scan and bone scan to see if it spread out of the prostate. It did not spread out of the prostate, but he was ready to send me to his radiologist and so forth. And I said, it's my prostate, I wanna check it out. I know I don't want to be incontinent. I don't want to have bowel issues, but I also am concerned about sex and sex drive and so forth. I'd like you to address that somewhere.
So Dave, I hope you can appreciate this, but what I did was I took the CAT scan that you had, and then I contoured your prostate to create a three-dimensional image. Now you see only 2 dimensions right here, but we did a 3-dimensional reconstruction of your prostate. And then I put beams on to show where the protons are going to enter and stop within your prostate. And you can see how tightly these curves are. This represents different dose levels around your prostate. And what's so important is you can see that there's virtually no dose out here, here's your rectum right here, and your bladder is further superior. But you see how closely tight these curves are hugging your prostate. That's because the proton comes in, gives off all of its energy right inside the tumor, and it stops. So this is the area that gets irradiated and virtually nothing outside it. So that translates into very little, if any, risk of incontinence and probably the highest likelihood of preserving your erection function with this over any other type of conventional therapy.
Wow. Well, these are all things that I have to consider, but boy, I really like what I'm hearing.
Now, if you wouldn't mind, I'd like to take you back to the exam room. We're going to do a physical exam, and then we'll come in and we'll talk some more, and I can answer more of your questions.
Okay, great. Thanks so
Good.
much.
Come with me.
All right.